Hello, my name is Amber Jackson. I will be presenting the ethical standards and policy issues impacting care coordination. Introduction to care coordination and its importance. Healthcare coordination is the thoughtful structure of the activities and information exchanged among providers in order to provide effective and safe care to patients. Information interoperability helps in providing quality and safe care. As some of the most frontline healthcare workers, nurses are crucial in guiding and maintaining care in patients at different stages. In this presentation, we are going to discuss how healthcare policies and ethical frameworks can improve care coordination in our site and impact it. The purpose is to lead the patient-centered practices that will empower and assist the providers in their practice. Governmental policies affecting community health and care coordination. In a number of policy plans in the country, care coordination is highlighted. A notable example is the Affordable Care Act, which promotes integrated care delivery models such as accountable care organizations to enhance collaboration between healthcare providers. Medicaid expansion assists in providing low-income individuals with care that is of good quality, which indicates that it has a wider interest in improving coordinated care provision. The Health Insurance Portability Act. The Health Insurance Portability and Accountability Act provides the recommendations and safeguards of the adequate access in sharing health information in patients. Furthermore, state legislations that determine the scope of practice affect the provision of care and autonomy of the patient. Local departmental policies are also involved in handling infectious diseases and plans to discharge patients. Specific policy example, Medicaid funding cuts and impact at practicum site. Recently, the federal government came out with a decade proposal that may result in a reduction of Medicaid funds. The major challenges in my placement would include limited access to the care required, especially by at-risk groups who lack access to essential health services, and increasing health inequalities. The growing clinical needs and the deterioration of available resources also play a negative role in organizing the care of quality. Healthcare workers should also be involved in advocacy to make policymakers involved in the healthcare system and sustain the financial support. National policy provisions raising ethical questions. One reason why national policies are significant in care coordination is the ethical issues that they raise. The HIPAA healthcare policy creates a set of guidelines that help to secure patient health information, but it usually clashes with the requirement of healthcare professionals to share data in an effective manner. In the same vein, although the ACA is expected to enhance care coordination by applying electronic health records, there is also a risk of exposing the data to cyber attacks. One more patient autonomy consideration, decision making is a challenge, especially regarding the transition to value-based care models. Unequal Medicaid expansion within various states is also a matter of concern regarding justice. Studies indicate that one of the main factors contributing to the time lag in sharing crucial information about patients is the issue of privacy, which ultimately reflects on the patient healthcare outcomes. State level policy dilemmas and ethical implications. The variations in the Medicaid coverage and qualification policies state across states complicates the issue of coordinating care to everyone equally. Although the growth of telehealth enhances access to care, it also creates ethical issues of patient confidentiality and consent. The state legislation, including the 340B program, is also intended to enhance the management of the program and drug pricing, which can assist in the support of the safety net providers and increase their financial viability. Over time, regulations have a negative impact on the life of medical workers and patient safety. The result of this situation is ethical dilemmas in high quality and personalized care and the provision of necessary resources. Local policy challenges and ethical considerations. Local policies can create ethical dilemmas, including conflicts between public health rules, like mandatory reporting of infections and a patient's right to privacy. Healthcare policies should strike a balance between ensuring bed availability and promoting smooth transitions for patients. When healthcare resources are limited, prioritizing care becomes necessary, which creates ethical issues regarding fairness. Nurses have a responsibility to navigate these challenges and champion their patient needs. The Code of Ethics for Nurses, Guiding Principles. The Code of Ethics of American Nurses Association helps to ensure the necessary guidelines to nursing practice. Respect, accountability, collaboration, and advocacy of human dignity are the main values of the ANA. It gives an ethical recommendation on decisions related to care coordination, focusing on patient-centered care that acknowledges the social and cultural background of each individual. It is the duty of nurses to promote the professional values by following the ethical standards during the care process. Impact of the Code of Ethics on coordination and continuum of care. The professional rules of conduct in healthcare are essential in terms of providing coherent care to patients via the maintenance of dignity of every person. Treatment plans, therefore, ought to give priority to the values of the patients. Patients can express their issues in the multidisciplinary team through advocacy by nurses. Due to the enhanced communication among professionals, healthcare professionals must collaborate to make informed decisions. Responsibility is needed in order to uphold ethics and professionalism. Nurses can contribute to the reduction of healthcare disparities and increase patient outcomes and satisfaction by practicing ethics. Addressing health disparities and access through ethical and policy lenses. Social factors such as education, income, and environment have a significant impact on health outcomes. The expansion of the ACA, Medicaid, and Medicaid has greatly improved access to health care. Though the improvements are not equally distributed. Healthcare professionals are vital in promoting care coordination to tackle disparities by accessing both medical needs and social preferences. Integrated care models emphasize the importance of improving adherence to treatment plans and reducing readmission rates. Nurses have an ethical obligation to promote equity and justice in delivering care. Key ethical and policy issues summary for practicum site. Balancing. One main ethical challenge in our practicum is balancing patient privacy with the need to share data for coordinated care. Navigating. Healthcare providers should navigate complex payment models, autonomy, and value-based care. Addressing. On a state level, addressing disparities such as medical funding cuts is vital in tackling healthcare inequities. Maybe that means to say inequalities. Ensuring. Additionally, the allocation of ethical resources and careful discharge planning are key considerations. Promoting accountability and collaboration are persistent key concerns in healthcare, guided by the principles of the ANA Code of Ethics. Implications for nursing practice and advocacy. Nurses in the healthcare systems are significant contributors to the enhancement, policies, and ethical and high quality treatment as a result of excellent coordination of care. Ethical competence is important in safeguarding patient interests and responding to their anxieties. Inclusion of policymakers in the coordination process is a guarantee of continued funding and care access. Cultural sensitivity should be integrated in provision of care to enhance the care delivery. Knowledge should be updated regularly so that the healthcare providers can make an informed choice in complex cases of care. Preparing for future policy changes and challenges. Healthcare practitioners in nursing facilities ought to be prepared to adopt their care approaches to keep Medicaid funding issues and ambiguous reactions at bay. Healthcare technologies, such as EHR systems and telehealth, can be used to balance the privacy and care of patients. Workforce policies, including those that deal with overtime, should be implemented to enhance care delivery and burnout. The medical practitioners must encourage the use of fair policies that put into consideration the most important aspects of care delivery. Through teamwork, resilience, and ethical leadership, we are able to effectively tackle and overcome the challenges we go through. References are provided, and that concludes this presentation. Thank you.